Historically speaking, and based on what you've seen and what you've learned being a professional in the addiction industry for decades now, why is addiction so hard to talk about?
I think addiction's really hard to talk about because people still stigmatize it. Most people who don't have addiction are vulnerable to failing to understand what it really is. It's a very different relationship to use of a substance than their own experience can tell them about. So the vast majority of people will have some alcohol. Occasionally, maybe they get drunk and do silly things. And yet, alcohol isn't super special for them. For people with addiction, it's a different drug. It's a way both better because it draws people to it and worse because it ruins their lives drug for them. And that's true really of any type of drug. The majority of people won't develop an addiction if they try something once. I'm not advocating that people run out and try something because the risk is still pretty high. And if you develop that problem, it's awful. So I think there's the stigma. People don't understand it. And there's this common idea throughout history for centuries. People have looked at it in one way or another as either a moral failing or a character flaw. So I think that's part of why it's really hard for people to accept and talk about any kind of addiction. And then there's the legality or the illegality of substances. So by nature, if anybody's using an illegal substance, they are less likely to feel comfortable talking about it in a public way because, they could get themselves in some kind of trouble, or because it's stigmatized, someone will look down on them.
Addiction continues to be stigmatized, and yet it affects every single family in this country. And it's an epidemic. It's a public health crisis. We don't stigmatize other such illnesses.
Correct. I think things are changing, though there's still a long way to go. Mental illness is stigmatized also. I think it's improving there. We don't stigmatize cancer so much anymore.
We don't stigmatize diabetes.
We don't, although to the extent that some people with diabetes have developed it because they've gained a lot of weight, we stigmatize the obesity that contributes to the development of diabetes. We tend to stigmatize things that many people will look at and say, it's your fault. It's a behavior that you engaged in that you shouldn't have.
Or it's a choice.
Right. And there are aspects of persistent substance use among people with addiction that really involve the loss of choice or control. And sometimes, almost from the beginning, an absence or the lack of choice. There's another aspect of choice, which is whether you decide even to try something. And our society, in a way, is intensely ambivalent about its connection to intoxicating substances. Because on the one hand, we look at any kind of aspect of popular culture and there's a glorification of being drunk. It's the vision of a good time. And of course, our young people want to use alcohol. And of course, many parents, the vast majority of adults in this country, do use alcohol without a problem. It's hard here because it's a choice, but it's a choice that our society pushes people toward, similar for pot and certainly tobacco or nicotine also.
I'm thinking about all the television ads about alcohol and how they glamorize drinking. They show beautiful people dressed in nice outfits, having a great time with their tequila or their hard seltzers, which may be particularly appealing to young people. But what these ads don't show is the next morning.
Right. When nobody woke up wishing they'd had another. All the drugs we're talking about have dangers that include, but are never limited to the development of addiction. They have interactions with psychiatric illness, depression, and anxiety. And unfortunately, sometimes the drugs that people use self-medicate those symptoms. They feel better, in the short term when they use.
But they are exacerbating those symptoms of depression and anxiety.
That is true. And yet most people don't realize it because in the short term, they get benefit. The next day, maybe they're a little worse with rebound symptoms of anxiety or sadness, and they do it again. And that itself contributes to the development of a compulsive use problem.
What do you think are the biggest fears that parents have when beginning to confront or approach their loved one about their suspected or proven drug use?
I know parents are often afraid that they're overreacting, that their kid will get mad at them, that they're being hypocritical because they tried drugs too, that their kid will run away if they set too harsh limits. Parents are often afraid. And I think I've only scratched the surface of some of those reasons.
Sure. What is the reluctance to deal with it early on rooted in?
I think some parents are worried that they're going to make too big a deal of something that is a phase. It's like, okay, not a big deal. I think some parents are worried that if their kid isn't doing what a lot of other young people are doing, they won't be socially successful.
So wait a minute. Are you suggesting that some parents think it's okay for their kids to drink or try a little puff of marijuana or pills so they'll fit in?
Yes. I think some parents do think that, yes.
And what would you say to those parents?
Be careful. The parents may project their own experience onto their kid. I tried pot, no big deal. I drank in high school, sure. And so there's a vulnerability for parents to minimize the problem and recognize that their kids can possibly do these things without having a problem. It's risky. Most parents don't want their kids to, well, fill in the blank, develop an addiction to cannabis, to alcohol. I would say, make sure they know what you value. Make sure they know that you think they're better off not using drugs, not getting drunk, not getting high, not fitting in as much as they might want to, because fitting in now might come at the cost of an awful addiction later.
I'm thinking back to my first experience with drinking, and it was beer.
Mm-hmm.
And that first sip of alcohol, it's intriguing when you're a teenager.
Mm-hmm. I cannot tell you how many people tell me about their first alcohol experience, usually in their early teens, maybe a little later sometimes. And they got completely drunk, really sick. And yet, they really remember the early part of that experience fondly. And the aversive part of getting sick, so they were vomiting and felt awful the next day, doesn't matter. What people chase is the early fun part. In general, addiction involves continuing to do something despite all the obvious and powerful negative results. Unfortunately, in this country, about 50 people a year die of alcohol poisoning. And it's because it makes people stop breathing. And most of those are on college campuses with hazing rituals, where people who aren't used to drinking a lot, so they don't have a lot of tolerance, drink a very large amount in a small period of time, in a short period of time. And then the amount of alcohol in their bloodstream gets so high that it turns off the automatic drive to breathe. And so it's a tragedy for those people when it happens.
Given that alcoholism and drug use is so rampant on college campuses, perhaps parents with college-age kids who are struggling with addiction may want to reconsider sending their kid back to college after getting treatment.
Great point. College is a risky place for young people with addiction. It's a risky place for young people, period, for lots of reasons, many of which interact with addiction, situations where people get drunk and they black out and they don't know what they did the night before. And people are vulnerable to various kinds of assault, including sexual assault. In that way, even for people who don't have a problem with addiction, those choices often encouraged by other people their age to drink too much or to use other drugs that put them at risk. It is dangerous. And then for people who've had an addiction, the availability coming in the form of physical availability, cost availability, and psychological availability, meaning people do it. All people should really think carefully about how to go back to college safely. And there are sober dorms at many colleges. And that can be one feature of a way to go to college safely.
What do you see as the biggest challenges facing parents when talking with their kids about alcohol use, drug use, playing video games, etc.?
Ineffective communication. That's the biggest challenge. Parents often communicate in a way that comes across as judgmental, and their kids won't hear them. The biggest challenge is to be able to have a dialogue with your kids, communicate your values, share your concerns, and set the stage for them to talk to you about their concerns.
And that should start at an early age, I assume?
Very early age.
Yeah, like as young as 5, 6?
Yes, sure. Even before.
You have spoken about the importance of parents doing their homework. What does that mean?
Parents doing their homework will include thinking about individually and together what their values are. What do they want their children to understand about their view? Even though teenagers and sometimes younger children don't want to seem like they care about what their parents say and think and feel, they do.
But they do.
They do want to hear about it, even though they won't admit it. And it's important for parents not to need that gratification that their kids are going to say, "Thanks, mom and dad, for telling it like it is," because they're not going to do that, and they're embarrassed. But I think doing the homework is figuring out what the parents feel separately and together, identifying the shared values they have as parents, communicating those shared values, and that could be about how to comport themselves, to be responsible citizens, to be good at whatever they are into, music, sports, academics, all of the above, whatever it is. And then thinking carefully about specifically as it applies to substance use, what they will accept, what they can't abide, and making sure the kids understand that, and then doing it effectively. I think parents would do well to get help practicing those kinds of discussions. Very few people do it, right? Who goes to a therapist?
This is what we're going to do Friday night. Yeah. We're going to practice how to talk to our kid. But
I'm saying it's a good idea.
Go ahead and try it.
Why not? We get better at everything we practice.
Why not? It's about your kid's life.
Right.
What about when parents talk about their values, they talk about boundaries, and the kids push back and say, "Hey, mom, hey, dad, I know you smoked pot in high school because you told me."
Right.
And they push back.
Yeah.
How should parents deal with that pushback?
I would say celebrate that they're pushing back because it means they're having a discussion with you. So say, "You know what? I'm really glad you asked. I guess as a parent, as your father, as your mother, I want you partly to learn from my mistake."
Is complete honesty, though, always the best policy?
Well, there are obvious exceptions. You don't have to tell your kids that you were a wild partier. Some kids will hear that and take it, no matter what else you say, as a kind of permissive statement. "Oh, dad did it, and I love dad. I want to be like dad." As a person who provides therapy, I tend to encourage honesty and openness almost all the time. However, you got to know your kid. You got to do your best. We all get it wrong with our kids sometimes. You do your best.
Well, let's talk about you and your family. So you have 4 kids. They're all adults now. How did you talk to them about alcohol and drug use, especially given that you've been a professional in the field for as long as they've been alive?
Yeah. My kids did know that I helped people who developed addiction, and they had some understanding of that. I'm not sure I did it all right. Although fortunately, I think none of my kids has an addiction, and it does run in my family. Yeah, how did I do it? It varied with each one to some extent. I probably got better at it with the younger ones
So by the fourth kid, you were a pro.
Well, not sure, but I might have been better at it. My kids knew that I didn't want them to use hard drugs. My kids knew that we didn't want them to use tobacco. My wife and I didn't come together exactly. We have similar values and we knew that. We didn't plan it as well as we might have.
I have plenty of friends myself who have said, these kids are going to drink and drug anyway. I'd rather have them doing it under my roof where I can keep an eye out and I can control it. Rather have them here than somewhere else. What is your response to that?
I don't think that's a great choice. It communicates an express permission to do things that are risky, illegal, and most parents don't realize that they take on a certain liability. Depends on the state. Every state's got somewhat different laws. But for underage drinking in their home, even if the parents aren't there, in some states there's a responsibility. This really does vary, but it's not the greatest idea.
Here are the consequences of what could happen.
Well, yes. One is if they break your rules, but also you're talking about the consequences of drinking and getting into trouble with all the things we've talked about: alcohol poisoning, assault risk, blackout, lots of dangers.
Mm-hmm. So often we hear of parents blurring the lines with their kids. Mm-hmm. We hear moms say, "My daughter is my best friend."
Yeah. If you are your child's best friend or even a friend, it blurs the line around your job as a parent. When they're young, your role as a parent, I would argue, all our roles as parents, is to encourage the children to grow and to become responsible adults. And that's not the role of a friend. That's the role of an adult mentor, guide, parent.
That desire to be the cool parent, mm-hmm. Is it connected to the fact that lots of parents don't want to look at or stop their own drinking and drug use?
Could be, sure. Obviously, some of the parents of children with substance use disorders have addiction or problem substance use themselves, and they don't see it. So that not only do they not see it, they don't want to see it, and they won't look at it. Denial takes many forms. And if a parent has a substance use disorder, they're not as likely to see the problem in themselves, even if they see it crystal clear in their child.
Why is denial still so powerful, even if the red flags are right in front of you?
Well, people see what they want to see. And a lot of people don't want to see it, especially if they have no idea how to solve the problem, either in themselves and or in their children. And it's painful. It's painful to look at this stuff. It's painful to see your child suffering. It's painful to see your own suffering.
When parents begin to have those important conversations with their child about the impact that drugs and alcohol could have on them long term and already are having on them, is the teenager, young adult brain even capable of listening and understanding the gravity of the situation? When I was 18, mm-hmm. I knew everything. You couldn't tell me anything.
Right. Often the adolescent or young adult brain is not capable of seeing long-term risks in the same way that later adult brains see it. Nevertheless, some can, and the discussion should happen in my mind, even though not everybody can hear it.
But kids are driven by emotion in the moment.
Yes,
right?
Very much so.
Their thinking skills and their planning skills are still developing.
Correct. Young people especially are driven by emotion and impulsivity and peer pressure. That drives the emotions, and everyone else is doing it, and you want to be part of the group. You want to have fun. You can communicate in earlier moments when you say to them, "Listen, I'm really worried about this party you're going to or this music festival. I know there's going to be a lot of drug use. It's really important for me that you understand how much I don't want you to do those things. Can we talk about that? And then can we plan for how you won't?" Give your kids a chance to practice refusal skills, because the kids want to connect with other kids. And it's hard to say no and feel like they might not, and fear that they might not want to connect with you. So give kids a chance to practice that skill, refusal skills.
Is there a difference between how addiction affects young women versus young men?
Sure. There are gender differences for men, women, and in ways that I think we don't have any research about transgender individuals as well. Women are more vulnerable to the effects of alcohol than men. They don't have as much of an enzyme that breaks alcohol down in the lining of their stomach. There's a smaller body weight on average. So, especially women on average are smaller. So, and then there's a third reason, which is that women will have a higher amount of body fat percentage-wise than men on average. And what does that mean? Well, the alcohol doesn't dissolve into the body fat. It only dissolves into the part of the body that's not water. So women get more drunk on the same amount of alcohol than men.
Young women and all women metabolize alcohol quite differently.
Yes.
And so that could make it more dangerous.
Yes.
What about treatment for girls and young women versus treatment of boys and young men? Does that look different?
Intrinsically, with the focus only on addiction, I don't think there are giant differences. However, because the experiences of boys and girls or young men and young women do differ, including that I think many of the young women with addiction are much more likely to have been victims of assault or survivors of assault. And so in that regard, women may more likely need all female groups to feel comfortable talking about some of their experiences.
So let's say that your child has completed residential treatment, then gone on to sober living, and then maybe done a step down program. And now they're out in the world or they're back living under your roof and they relapse.
Mm-hmm.
Relapse is a common part of recovery, is it not?
Absolutely, yes.
What's your best advice for parents whose child has just relapsed? The best ways to approach dealing with it and how to be patient, even if they don't want to be, even if they're angry about it and they don't understand it.
Relapse is part of recovery. It happens commonly. Doesn't always happen, but it's common. So accept that in advance as something that's part of the equation. There can always be a kind of updated recovery plan or recovery protection plan. And understand, part of the plan is for yourself. Keep taking care of yourself. Forgive yourself. Understand that it's normal for you as a parent to feel scared, angry, frustrated, disappointed, and hopeless sometimes. And it's not hopeless. A relapse is part of recovery. You have a plan. Enact the plan. Keep trying. It's not how many times you get knocked down. It's how many times you get up.
And no shaming, no blaming?
I think those are destructive. So yes, no shaming, no blaming. They don't help. Understand what contributed to the relapse. What happened? How can we learn from it in the future?
Right. But it doesn't mean you have to give up on recovery just because you relapsed once, 5 times, 20 times.
Nope. I have worked with people who've relapsed dozens of times until they get it. Until then, long-term recovery takes hold. And as long as they keep trying, it can work.
So your message to parents is, even if they do relapse, this is not the end. Be patient with them. Let them try again.
Right.
Encourage them to try again.
It's a bump in the road. It happens. Keep at it. Do something else. Do something that worked before again. And keep in mind that it isn't all or nothing. Your child will often have learned something during 6 months of recovery. And if they have a lapse, which is not as severe as a relapse, but it's an episode of use, or a full-blown relapse where it's really serious and damaging and destructive, either way, if that happens, they can stop again and they don't lose all the progress. I do know that in 12-step programs, people start counting days again. And that makes sense. People put a lot of value on a sobriety date. However, my experience shows me that those children haven't lost all that they gained in 6 months of long-term sobriety. And they can get a lot of that back within days or a week or two.
Doctor, you were way ahead of the curve with medication-assisted treatment, which is now called something different, isn't it?
Medications for addiction treatment is a preferred way to say it, but MAT, and people do use both those phrases. I'll explain why it matters. Medication-assisted treatment implies that for everyone, medications assist another form of treatment. The reality is, for some people, medications are all they need. Medications for addiction treatment, particularly with opioids, save lives. We've seen with multiple studies across many people, across many places, that for opioid use disorder, which we know has been killing more and more people every year, year over year for the last 20 years, we know that medications, and specifically, there are 3 different ones that act on the opioid receptor: methadone, which has been around a long time, and buprenorphine in the form of a product often called Suboxone or Subutex, and naltrexone. All have shown that they reduce relapse risk and overdose death. And the overdose death risk is particularly important. They work by different mechanisms, and I think it's probably beyond the scope of this discussion for me to go into all those details, but they work. They help people, they make a difference, and they're generally, especially Suboxone and long-acting injectable naltrexone, they're generally well accepted by patients.
Do you keep those things in the household?
Yes, I encourage every family where anybody in the family, even if they don't live in that house, has an opioid use disorder or is on opioids prescribed for pain, to have naloxone. That is not generally considered part of the MAT, medications for addiction treatment. However, naloxone saves lives. It's the antidote to an overdose. It blocks and disrupts the effects of an overdose by pushing another opioid. Let's say someone took an overdose of heroin or fentanyl. It pushes the other drug off the receptor, and a person can start to breathe again. So I think everybody should have naloxone in their household. They should be everywhere, just like a fire extinguisher or a carbon monoxide detector.
And it's important for parents to know that it's easy to use.
Not only easy to use, easy to get, even without a prescription.
And how do people get it?
In most states in the US, you can get it at a pharmacy, even without a prescription. You can get it at events sponsored by treatment programs where people give it out and want anyone who's interested to be able to have it. You can certainly get it by prescription. And in many settings, insurance pays for it, and it shouldn't cost you very much out of pocket. Saves lives, well worth it.
Are medications like Suboxone actually opioids?
Yes. Suboxone, which is the brand name for a form of buprenorphine, is an opioid. It has some special properties pharmacologically that make it a little different from other opioids, but not enough for us not to call it an opioid. It's an opioid. And that is part of how it works. It basically blocks the opioid receptor by sitting on it, activating it, and preventing other opioids from reaching it. And so that reduces overdose risk.
When parents are trying to understand more about MAT, does that include antidepressants?
No, and I'm glad you asked, because antidepressants aren't for addiction treatment. It's interesting because sometimes, not usually, but sometimes if we help someone with depression, their vulnerability to relapse goes down. So it doesn't hurt their addiction. But technically, meds for addiction treatment are medications that have shown that they help a person achieve and or maintain long-term recovery from substance use disorders.
So if your child is on an antidepressant like Paxil or Celexa,
sure,
they can stay on those
yes.
drugs while also receiving medication like Suboxone.
Yes. And the doctor prescribing those, or the doctors prescribing those, will know about the potential interactions and will help each person decide for themselves. But yes, one can, and usually almost always, should stay on their depression meds and their medications for addiction treatment. I'm an addiction psychiatrist. There are addiction physicians. Sometimes nurse practitioners and physician's assistants can also prescribe these medicines. But the doctor or other healthcare professional who prescribes is usually someone who's done special training in understanding addiction. And they've devoted their career to specializing in this field.
And maybe for some parents, they can look at it as, all right, my child is taking this medication, but is it really any different from taking an antidepressant?
So in many ways, it's not different from taking an antidepressant. However, in some ways, it's easier to get off an antidepressant than it is to get off Suboxone, for example, for opioid use disorder. Nevertheless, I treat people who've been on Suboxone now for almost 20 years since it was first approved in this country. And they live successful, happy lives, sober. One of the criticisms that some people throw at methadone or Suboxone for opioid use disorder is they, in my mind, quite mistakenly misunderstand that having an opioid in their body is equivalent to, which it isn't, but they see it as equivalent to being in relapse. Or they say it's substituting one drug for another. It's not. Maintenance treatment for opioid use disorder with an agonist, a buprenorphine or methadone, is something that allows people to live a good life. So for parents out there who might be concerned if their child is on buprenorphine, Suboxone, or methadone, and they are worried that it's substituting one drug for another, and they may not understand the difference. The differences are huge. Being on a maintenance treatment for opioid use disorder enables a person to live a complete and full life. Being addicted to heroin and needing to get up every day for a fix, needing to hustle every day to get the money to pay for that, that crowds out any other good thing in life. Being on Suboxone means a person can take their medicine every day. They won't crave opioids. If they accidentally have a lapse, it actually protects against overdose because it will block the effects, or many of them, of the lapse or relapse. And so it saves lives and improves lives. It's a big deal, and it's way different from substituting one drug for another.
You and I have talked about how there are many ways that parents can help their children. And you've said it's really important not to rule anything in or out. MAT, psychotherapy, behavioral treatment, 12-step programs.
All of the above. I don't want anyone to rule out any form of help, even if it doesn't fit with their worldview, because we don't have a one-size-fits-all treatment, but everything helps somebody, and nobody knows what's going to work until they try it. So don't rule anything out.
On this platform, we talk about the importance of community being absolutely essential to the recovery process. Speaking from my own experience, I know how important community has been to my recovery. And I used to go to a place for 12-step meetings that was called the YANA Club, Y-A-N-A. And it stood for You Are Not Alone.
Yeah.
How important is that for parents to know?
Tremendously important. Every parent who's struggling with a family member with addiction understands that addiction affects an entire family. Sharing with others a sense of community, Yana, you are not alone. I can't emphasize enough how valuable that is for the majority of people I work with. At the heart of it, we believe that an educated parent is a more effective parent. And these illnesses are really hard. Families need help because working with someone who doesn't necessarily want to give up the drug is hard. It's really hard.
Our mission here at Real is to inform and educate and empower
and support.
Any final thoughts from you on what we are doing to help guide families to make better choices?
Becoming part of a community like the Real platform can provide you with the support, the information, the forgiveness and love that you need by sharing your experience with other people who've gone through very much the same thing as you. That is such a powerful part of life. We all feel supported when that happens. I think over time, as we develop, parents can find ways to contribute as well. If you found our platform helpful, pay it forward. And finally, I guess for me, never give up. Don't lose hope. These illnesses are hard and sometimes terribly tragic. And yet, I think every parent can keep going. And we're really here to help all of you do that. Every day, I work with people prior to recovery, in early recovery, and long-term recovery. And seeing all the many fabulous things that people in long-term recovery accomplish gives me hope.